How's she been doing? Is it Milena?
Milena, yes, sir.
Hello, Milena. How are you today? It's nice to see you, my friend. You're enjoying the TV.
She lost it. Let's turn it down.
She's 5 years old, correct?
5, yes.
5? 5. How's she been doing? Has she had any dental pain? Any complaints in her mouth?
No, that's why we were even wondering if we should be doing this, but everybody advised that for the future it's good to do it now so that
because it will get worse.
So the permanent teeth don't get affected.
Yeah, it's more, not so much the permanent teeth as these. So she has cavities, looking at her chart and her x-rays, she has cavities on her back 8 molars. Okay? Looks like her front teeth are in pretty good shape.
Okay.
These back molars, those far back ones, they don't fall out till she's about 12 years old. And the ones in front of that fall out when she's about 10 and a half. Okay? So that's a long time from now. They would get worse. She already has some that are a little bit bigger. One on the upper left, and she has some that are smaller also. And for some of the smaller ones, the only reasons we know they're in there is because we took x-rays and we can see them.
Yeah.
So you want to get those smaller ones while they're smaller, because what happens if they don't, in 1-2 years, then she has 8 big cavities. Then you're talking about she can get pain, she can get infection, and then you're not talking about fixing a tooth, you're talking about taking out a tooth.
Extractions.
And I don't think we're there at all. That's okay. So some of these are small that we're planning tooth colored fillings, okay? The biggest one is on the upper left, and I can see there's a big cavity up there. And we're going to definitely for sure be putting a little silver cap on that one. Now, 2 of them she has planned here that are kind of more medium size, okay? So when I
need to do a better job at brushing far back.
Yes, and some of this is in between the teeth. We're talking about
so
flossing.
Floss.
Yes.
So you need to use the little placers and floss between the teeth. Okay?
Now a couple of these she has both on the treatment plan. They're more medium size. If I clean it out and there's enough tooth structure, I'll put a tooth colored filling in. If it's bigger, I'm going to put the little silver cap on. Yes. I'm going to take some new x-rays to see where we're at today. Okay, that'll give me more information. I will also clean her teeth. I will do a fluoride treatment. I will take care of everything.
Yes.
I think it would be very unlikely to have to take out any teeth. She hasn't had any pain.
Right.
They don't look that big. I would be surprised. I can never say never because you never know what you get into.
Yes.
But I think the likelihood is very low based on the preoperative x-rays that we have. So I would be surprised if that was the case. Should take me, I'm just going to say, on average, about an hour and a half or so to get it done. There's no rush or anything. Sometimes a little longer, sometimes a little quicker. It just depends if I find anything new. And if I find anything new, I'm going to take care of that too.
So we're hoping for a one-stop shop then.
Yes. Yeah, you'll get that no matter what. I won't leave any stone unturned here.
Okay.
Don't worry. I will find everything. And like you said, it's we have a good, so for some of these young kids, they're not cooperative enough to take x-rays, so it's a little bit more of a guess. We've got a little bit more information on her, which is helpful. Has the anesthesiologist been in yet?
Not yet, no.
Okay, I didn't think so, because it's still kind of early. It's a later start today. Usually I start at like 7:30. But, and I forgot that, so I came at 7:30.
Came early too, because they told us. And usually on time is late, so we want it to be early.
No, absolutely. When I'm getting close to finishing, okay, they're going to call you. You'll be downstairs and wherever they tell you to go. Then you'll come back up. So as they're waking her up, I'm going to come talk to you, go over post-operative instructions, let you know everything you did, kind of talk about that.
You don't want to fall asleep. Trust me, you want to fall asleep for this one.
Absolutely.
How did they put you to sleep?
Well, that doctor will be coming. You guys can talk about that. I'm just the teeth guy.
Yes.
So, then I'll go over post-op instructions, let you know everything I did, and whatnot. If anything new, anything changed, if it all stayed the same, that sort of thing. So that's my plan. I'm going to taken care of. You guys can recover for the weekend, and you'll be good to go.
Sounds
starting fresh.
You can start eating candy when?
Tomorrow, I guess, but not too much.
Where are you going?
So,
tell me something. Okay.
So
He's a boy dentist, not a girl dentist.
Yeah, so I know you saw Dr. Brittany before, but you got me today. You'll see Dr. Brittany.
Boy dentists are just as good as girl dentists.
Absolutely.
Okay.
You'll see the girl dentist again if you come back for our regular checkups. You can see Dr. Brittany.
Don't take the bracelet off.
So as far as the dental treatment, anything I talked about, is there any questions I can answer for you?
No, everything's fine.
We'll get her taken care of, okay? And
Excellent.
anesthesiologist will be in eventually, and the nurses, and you guys will chat and
Thank
talk
you.
about all that stuff. It's nice to meet you. Nice to meet you, young lady. Thank you so much.
And thank you for letting me record this for Mom.
No problem. Absolutely.
Yeah.
All right. Took some new x-rays, really not a huge change. Okay, there was one extra tooth I found, more where I could see it, a front tooth, just in between the tooth. There's a little dark spot, just a little cavity starting. Just do a little tooth color filling, okay? Between the front tooth there. Other than that, so on the upper right, they were in between the two teeth. They were small, planned two tooth colored fillings. That's what I did, okay? The upper left, the back one was the biggest one. I was planning the little silver cap. That's what I did. It didn't go to the nerve or anything.
Okay.
The first molar next to it on the upper left, planning a little white filling. That's what I did. Okay. The lower left back molar, small, planning a little white filling. That's what I did. The first molar was more medium. We're planning either a white filling or a silver cap, depending on where it went. That one wasn't too bad, so I did a white filling. Okay. And then the lower right, same thing. The back molar was small. We're planning a white filling. First molar was more medium-ish. That one was a little bit bigger, so we did a little silver cap. So I ended up doing two. One on the lower right, one on the upper left. The upper left was no doubt that had decay on the top and between and on the side. The other two were like where we were going to see. I split that. I had one I did, one I didn't. Clean the teeth. Put a fluoride on the teeth. Just take it easy this weekend. We didn't take out any teeth. You should bounce back really quickly from all this, okay? So maybe a little softer diet today. He'll let you know. Gums might be a little irritated, a little sore around those little silver caps. And just some Tylenol or ibuprofen will be fine if you need it.
Since she already had Tylenol, should we stick to that? Or?
She had do they give Tylenol? You could, yeah. Or you can you can split. It doesn't matter.
It doesn't matter. Okay.
Yeah, whichever one will work. They gave medicine through the IV and stuff, so you're fine for a while. You don't have to brush today, but start brushing tomorrow, because it just clean the teeth.
Right.
We'll give her a break in there.
Teach her to floss, I guess.
Take it easy for a couple of days.
Okay.
The gums are going to be a little sore, so just give a little break. But we should do well.
How did she handle the?
Like a rock star.
Okay, because she's really tiny and we were really worried because she's not a
I know. I looked at. No, she's just small.
She's not
I know. I'm like, she is small for a 5-year-old.
She's 30-some pounds.
Yeah. So she did fine. She went to sleep really nicely. I was watching. That's their job, but I was watching. Waking up. I do a lot of 2- and 3-year-olds up there. They wake up very unhappy because they don't know what's going on. She's a little bit older. I mean, she's 5.5, and she seems to be pretty mellow personality, so she may wake up just kind of quiet, at least for me.
Listen, she's a mellow personality.
Well, I mean, from the little I saw today. Plus, she had that medicine, so that helps. But they don't always wake up happy. That's why I'm talking to you now, so when they're ready for you, they're going to come get you. She's already in the recovery room with the nurses. I've already talked to them. They're just waiting for her to wake up a little bit more. Sometimes that's quick, sometimes that takes a little longer, but they know you're here. They're going to come get you. She's literally, not 20, 30 feet away from us. So they know you're here. And then you should do fine this weekend, but if you have any questions or concerns, there's always a doctor on call. It's one of my partners. I can't remember which one, but you call our office, there's a way to get a hold of them. It'll tell you, hey, if you have an emergency after hours, press this button, blah, blah, blah.
When it comes to food, should we avoid too cold or too hot, like ice cream?
No, I think ice cream would be good. It'd be good. Ice cream would be good. She should be. I mean, I didn't take out any teeth. I only did 2 of the caps. With some kids, I take out a lot of teeth. It's a little rougher. I mean, you could keep it a little softer, but she'll let you know. I'm not too worried about her. In her case, yes. That's what I think. So, all right. Any other questions for me, sir?
No.
It's all done. We're good. So. And then just a 6-month checkup with Dr. Breeds.
We'll
Dr. Brady.
definitely follow up on that.
Okay. Awesome. Well, have a great weekend.
Thank you.
Thank you, sir.
I wish I could shake your hand.
Yeah, I know. We can't do it anymore. I know. A couple times parents are like, and I'm like,
I know.
nothing personal.
Thank you so much.
Sure. Take care, sir.
Milenka, we're going for a ride, Tati. Say hi to Mama. You want to say hi? No? Maybe not. Maybe later? Hmm? Still sleepy. Okay, Tati.